decrease the chance of having a heart attack or dying from a heart condition while running a marathon. I know that sounds scary. Believe me, I get it. And I'm not by any means trying to discourage you from running marathons or running generally. Exercise has so many benefits, and running especially in terms of physical health and emotional and psychological and social benefits. By no means am I trying to discourage you from running marathons. But one of the things that I think might surprise you is even people that are in good shape running marathons can actually have heart attacks and, yes, die of sudden cardiac deaths. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise, injuries and injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. When I mention sudden cardiac arrest in marathons, immediately you might think of somebody that's a little out of shape that's trying to run their first marathon. And that does happen, but you'd be surprised. Actually, experienced marathoners can die of basically a heart condition during a marathon. There was a study not too long ago in the New England Journal of Sports Medicine, the New England Journal of Medicine, and I don't remember the exact numbers, but it was essentially something like 1 in every 184,000 marathon competitors suffer a sudden cardiac arrest. And I think the deaths were somewhere about 1 in 250,000. Doesn't seem like a lot, but when you think of the numbers of people that run marathons in the United States, these deaths can happen. And yes, they occur in people that have completed a marathon in the past. So, experienced runners aren't necessarily immune. So when we talk about decreasing the chance of heart issues and heart deaths in marathons, we have two ways to look at it. You have preventing it from the healthcare provider side in terms of the medical coverage of marathons, and then you have it on the side of the runners. What can the runners do to decrease the risk? Let's start with the race itself and the medical providers. We know that probably the biggest thing that improves your chance of survival after a cardiac arrest is use of a defibrillator, an automated external defibrillator, fancy way of saying AED. Those are the boxes that carry around. You open it up, you put the leads on the person, it talks you through it, so you don't really know that much how much you need to use it. It tells you where to place the leads, when to press the button, and it can basically shock the heart to get it going. We probably need those not just at the finish line, but throughout the race. Yes, most of the cardiac events tend to occur in the last few miles of the race, but maybe as an event organizer, you work with your medical team that's going to cover the race, not to put everybody at the end of the race. Maybe you put most of your people there, but put a few healthcare providers, it could be doctors, it could be nurses, it could be paramedics at various points along the race, and then maybe also put AEDs at all those stations. Even, train bystanders, train spectators, yes, medical professionals, even event volunteers in not just the use of AEDs, but in CPR. The quicker that we start CPR, the quicker that we use AEDs, the better the survivorship rates, I should say. Okay, now let's look at it from the runner's side. I think the first thing that I would do, again, knowing that experienced runners can still have heart events, go see your doctor before a race. Maybe you go yearly. You may feel great, and if you're running marathons, you probably are in good shape, but get checked out. Obviously, we're talking about heart here, but make sure there's no other conditions that could impact the health of you during the race. But get checked out. It may just be telling your doctor about any potential symptoms. Certainly the doctor will examine you, listen to your heart, things like that. But they'll probably do an EKG where they put leads on your heart and get a basic tracing of your heart rhythms to make sure that you have fairly normal heart rhythms. They may even get an echocardiogram. One of the most common causes of sudden cardiac death is a condition called hypertrophic cardiomyopathy, where there's abnormal heart muscle that prevents your heart from ejecting enough blood, and basically you can die and die quickly, even if you've never had any symptoms. If you have had symptoms in the past, be it chest pain, shortness of breath, anything like that, trouble breathing during exercise, more than just you're out of shape and you're fatigued, get that checked out, even not on a regular basis. Get it checked out. Hopefully it's nothing, probably is, but better to find out on the front end than to have a serious event occur. Okay, does any of that surprise you? The risk of sudden cardiac death or cardiac events during marathons? Or do you run marathons? Do you see your doctor on a regular basis? Or have you heard of these type of events when you run marathons? I'd love to hear your experience. So below this video, share your thoughts, share your experience, your advice for other people. If you're a doctor, what advice do you have about getting your heart checked out before you run a marathon? Below this video, leave your comments. I would love to read them, and I bet runners all over the world would love to read what you have to say as well. If you know somebody that's a marathon runner or is planning to run a marathon, please share this video with that person so hopefully it can help them as they prepare to run for their marathon. Okay, if you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, I record a couple of these videos every single week. So subscribe to my YouTube channel. There's a subscribe button in the upper right corner, and you can get videos on ways to stay healthy and perform your best delivered directly to you. Thank you so much for watching. Again, if you know people that run marathons, please share this video. Don't forget to subscribe, and I look forward to seeing you right here next time.